Like Hillary. She once was a big advocate of health care. Is she going to do it again? Well, is she going to be careful this time?
It's possible. I mean, she hasn't put forth her specific plan yet. So there's still time to have influence on her for the people of this country to write to her and say, you know, when you put out your health care plan this time, please make sure it covers everyone. It's not going to cost anybody anything in terms of having to pay when you go to the doctor or the hospital. We want the same system that the other 24 of the top 25 industrialized countries have. That's what we want in this country, and if she does that, I think that it'll go far for her.
Do you think it's better in Canada?
Yes.
You think it's better in England?
Yes.
Better in France?
Yep.
Better in Cuba?
Yep.
Better
than Cuba. Oh, I thought you were going to say Norway.
Because I saw that list. You had that list on your. I just watched the Sicko. In the movie, there was a list of health care in the countries, and I noticed
they're two below
even
us.
though you build up Cuba,
they're
in the
two
movie,
below us.
Two below us.
Yeah.
Why are they below us if they've got socialized
they're
medicine?
only two below us.
I know that's pretty
one
scary.
of the poorest countries in the world.
But why?
And they're only two below us.
Well, let me ask you a tougher question. Why do the big shots in the world, the dictators, some of the real nasty people in the world, whatever their politics, when they have a real health scare, like they're going to die, they come here? Why? Why do they all come here to get fixed?
You mean the rich come
the
here?
Shah, whoever it is. I don't care.
Because they have money.
But why do we have the best health care?
Because, we actually have very good health care if you can afford it.
We have the best, apparently.
We have all the gadgets and all the equipment. We're very good we know what to do in a lot of these cases, and if you have money, you can have it.
Well, we still have it if we socialize or we go to national health care.
No, we'll still have it, but that's why a lot of people are afraid to do it, because if you share the pie, it doesn't mean maybe if you've got a lot of money, your slice isn't going to be as big anymore. So some people who have more money.
Will it be as good a pie, though?
Yes, it'll be. Yeah, it may not have all the frills that you get when you have more money in this country, but everone's covered.
But there's a trade-off. Let me ask you about
that.
No, I agree. I want you to explain the trade-off to the people watching.
Listen, I would rather have the 47 million who are not covered right now be covered, and if that means that someone like me who has money and has a good insurance plan because I'm a member of the Directors Guild, you're probably SAG after. Oh, well, excuse me.
Don't knock it if you haven't tried it.
No, but we have good health plans.
Right.
And so maybe, if something happens to us, we can get a private room at the hospital or whatever. So would you mind sharing your room with somebody if it meant that 47 million Americans would be covered tonight? Would you share?
Interesting question.
Would you?
I think I should. I'll put it that way.
You know you should.
Let me ask you.
You were raised by the good nuns, weren't you? Come on.
16 years. Let me ask you this about, that there is an advantage to the capitalist system, and I just want to bring it out because you think it's a bad system. But, the medicines we have in this country are pretty, like Metformin just got a great review for diabetes. I got diabetes, so I'm very aware of these things.
Yeah.
Would we still have state-of-the-art medicine in this country if it was socialized? We still have the best.
Absolutely. Well, they have that in these other countries, too.
But didn't they invent most of that stuff here?
Invent which stuff?
The drugs, the state-of-the-art drugs.
Yeah, our universities, our
Isn't that because of the capitalist system?
No,
but
it's not the
capitalism that does that profit?
Jonas Salk didn't find the cure for polio because he believed in capitalism. He did it because he wanted to help the people on this planet.
And he didn't get rich because
he didn't get rich. In fact, they asked him, aren't you going to patent this? And he said, no. Would I patent the sun? You can't patent something that's for everyone.
I thought about this the other day. I was thinking about, and I do agree with you about the Cuban doctors, although we can argue about it. I think Cubans are very popular in the world, no matter what we think of them. When they go out, they're popular here, the ones that came here. But Cubans as individuals, they go out in Africa and Latin America, and they work for very little money, like missionaries almost, and they are doctors, and people who never could get health care are getting it. Why don't we have in this country some other kind of doctors that they're not all fancy, but doctors that can go out in rural areas and where people and set up clinics? Why doesn't Hillary set up a clinic? Why don't they set up clinics at every high school? Something basic like that, where everybody who needs health care, especially kids, can get it. Why don't we do that? That would
why
work.
Don't we? And why does Canada? Why do they have it better? The family doctor in Canada is paid more, a general practitioner, than in this country. Doctors in this country, yes.
And that comes through taxes.
Yes. Now the specialists are paid more here, so we have more specialists.
Right.
A family doctor in this country, doctors. If you talk to anybody you know who's a doctor who just has a general practice,
it's very complicated.
Oh, they're demoralized these days. They spend half the time fighting with the HMO, trying to get paid, trying to get a $15.
They're going to turn their offices over to the bureaucrats. It's amazing.
No, they would. Well, but that's the thing. A family doctor would rather have a Medicare or a Medicaid patient because
how many here?
Let's
try this, Michael. And I have no idea what the reaction is. We got how many Democrats here? Let's get a rough ideological check here. How many here consider yourself, and I mean it in the positive sense, liberals? Okay. How many here consider yourself conservative Republicans? She's the loudest. Okay, let me ask you, how many here would like to have a system of government-financed health care so that everybody, from the time they're born, gets health care? How many would oppose that? Okay, come here. This is the voice of the Republic. This is Micahel Moore, filmmaker. He comes from a different point of view. Give me a microphone because I want to hear this voice. And I'm bringing in you early. Here's your mic. There's your witness. What's your case? What's wrong with what Micahel Moore is saying? We need national health care.
I just really believe that the free enterprise system creates the most effective and the best coverage. And I know, obviously, something needs to be done so that we can insure the people who aren't insured. A large portion of Americans
What should be done?
Oh, well, I think, for example, the case in Massachusetts, I think it really needs to work with the private companies so that we're not just completely taking over from them, and they need to make.
What do you think of making
profit.
the companies and like a lot of the young people here? Would you all? Let me ask you this, everybody here. Some young people in their early 20s who are very healthy and they've been raised well with great nutrition and great educations. They know what's smart for them. They don't want to pay for health insurance because they figure their odds are pretty good at making it into their 40s or 50s without getting sick. Unless you're in a motorcycle accident or something. And basically that's your attitude, right? No. Are you willing to pay a certain amount a month so that that money can be distributed either through taxes or through a system where that money can go to people with need? Are you? Are you willing to kick in like when you buy auto insurance, you're counting on the car not cracking up, right?
Right.
But you still have to kick in because there's a certain percentage of cars that crack up, right?
Right.
Are you willing to kick into a selected or a shared risk program like National Health? You apparently aren't.
Well, I think it would depend.
To help the people that don't have it.
I think it would depend because the problem is for doing a national, a lot of times, that goes to everyone, and a lot of people don't need it. A lot of people already have good health insurance, and so when you're kicking it in like that, you said you're making the pie. I don't think the pie is as good, and I don't think that's.
So you wouldn't
healthy.
like to kick into a shared national health program?
I think it would depend on the specifics of it.
Well, the specific would be you have to kick in.
Oh, well, then probably not.
Probably not.
Can I ask her a
Sure,
question?
you're in charge.
What, I assume you're opposed to this term, the concept of socialized medicine, right? Now, we have socialized medicine in the U.S. Army. They don't pay for that. Do you think that we should privatize that healthcare system for the military?
Well, I don't really know enough about the
Well, you know what he just said.
health.
He said
We pay for it. Our tax dollars pay
Okay.
for our soldiers. Should we pay for that?
I think so.
It's a government run, though.
I know.
Should senators get health
unfortunately.
insurance free?
No profit in
Or
it.
should they have a health insurance plan that's government run? Why should they?
I don't know if they should
They got one.
specifically. They do. I know.
Well, why should they have one?
Well, I guess it depends that we want our senators to be healthy. If they're running the country, I mean, we want them in office.
Well, that's a
and not
start.
off,
How about our old people? Should we take away their Medicare? That's a socialized system.
I think it needs to be reformed.
But we should pay for it, though.
Are you?
Well,
Are you willing to kick in like when you buy auto insurance, you're counting on the car not cracking up, right?
Right.
But you still have to kick in because there's a certain percentage of cars that crack up, right?
Right.
Are you willing to kick into a selected or a shared risk program like National Health? You apparently aren't.
Well, I think it would depend.
To help the people that don't have it.
I think it would depend because the problem is for doing a national, a lot of times, that goes to everyone, and a lot of people don't need it. A lot of people already have good health insurance, and so when you're kicking it in like that, you said you're making the pie. I don't think the pie is as good, and I don't think that's.
So you wouldn't
healthy.
like to kick into a shared national health program?
I think it would depend on the specifics of it.
Well, the specific would be you have to kick in.
Oh, well, then probably not.
Probably not.
Can I ask her a
Sure,
question?
you're in charge.
What, I assume you're opposed to this term, the concept of socialized medicine, right? Now, we have socialized medicine in the U.S. Army. They don't pay for that. Do you think that we should privatize that healthcare system for the military?
Well, I don't really know enough about.
Well, you know what he just
military
said.
health.
He said
We pay for it. Our tax
Right,
dollars pay
okay.
for our soldiers. Should we pay for that?
I think so.
It's a government run, though.
I know.
Should senators get health
unfortunately.
insurance free?
No profit in
Or
it.
should they have a health insurance plan that's government run? Why should they?
I don't know if they should
They got one.
specifically. They do. I know.
Well, why should they have one?
Well, I guess it depends that we want our senators to be healthy. If they're running the country, I mean, we want them in office.
Well, that's a
and not
start.
off, I guess.
How about our old people? Should we take away their Medicare? That's a socialized system.
I think it needs to be reformed.
But we should pay for it, though, you and I.
Well, I think it's already in place enough that if you tried to take it away...
Should the president veto this bill to extend Medicare to kids whose parents make a little more than the poverty line? He's going to do it. He said so.
Well, I think that, again, that's a good case in the fact that you're getting maybe more of the middle class who aren't considered poor and who
So you're against the president on this one. You're breaking with him on this. You don't think he should veto that bill?
I don't know. I haven't, read enough about it. I don't want to...